Greetings and salutations, everyone. My name is Reggie Smith, and I want to welcome you to this edition of the listening session for G-PACC, the Georgia Prevention and Care Council. We do these listening sessions. We have been doing these listening sessions during the course of the last couple of years to get a gauge of what's going on in the community regarding HIV. Bring on my co-host and co-chair, Tito Terry. Hey, Tito, how you doing today?
I'm doing well, sir. How about yourself?
Good. So, we've been working on the planning for the state of Georgia. And as you know, we have been touching on a number of different topics over the past year regarding all of the different communities of HIV. And what we found out in the planning session is that there's a dearth of information regarding HIV as it pertains to Black heterosexual men. And we know that Black women are amongst the highest rate of new infections of HIV, yet heterosexual Black men are the least accounted for or represented demographic when it comes to HIV testing, treatment, retention, and or data. And if we want to end the epidemic, we have to include everyone and all come together for the highest good. So here is a place where we can listen to each other and make known the unknown. So we're glad that you could come out and join us. We've got some folks around that are in the community that want to share and lend their voices. Before we get started, I want to say that Tito is the co-chair for the G-PACC, the Georgia Prevention and Care Council. People probably don't know what that is. Tito, tell people a little bit about what G-PACC is.
Okay. So first, I'll start off by saying that G-PACC is a federally mandated, each state has to have a planning and care council for HIV services. But what I wanted to share about G-PACC, the most important part of it is our mission. With G-PACC, our mission is to collaborate with the Georgia Department of Public Health State Office by making recommendations to improve the HIV continuum of care in the state of Georgia by strengthening about 5 different areas. 1, the scientific basis that HIV prevention care and treatment is based on. 2, community relevance. Is the information itself going to be relevant to those communities that we're trying to reach out to? Key stakeholder involvement is the 3rd one. We want members from all the communities that we're trying to reach out to. We want them all to be a part of G-PACC, of which it is. Mm-hmm. 4, population or risk-based focus of HIV prevention interventions and high-quality care in the state. In other words, we want to make sure that all HIV prevention efforts are geared towards those populations that we want to reach out to. We want everyone to get the care that they need, but we also want to make sure that they're geared towards each individual population group that we're trying to reach out to. That way, everyone has the same care and the same access to care. Mm-hmm. And 5, communication and coordination of services across the continuum of HIV prevention, care, and treatment. In other words, we want to make sure that prevention and treatment are able to effectively communicate with one another in order to make sure that there's full equity of care for everybody. Yes. So that's G-PACC's mission, and I think that's the most important aspect of what we do. So that's what I wanted to share with everybody today.
And we appreciate you doing that. It's been absolutely wonderful serving with you and being on the stakeholder engagement committees. We've got the different committees and just meeting people from all over the state that are doing great work in the communities. We've had some road shows where we go out to the community and actually focus on those different organizations that are doing the work in the community. So we want to thank you. And of course, our leader, Vivian Moma, who is the liaison between G-PACC and the Department of Health. And she keeps us on point and keeps us going, and we really appreciate that. So thank you. And that's the Georgia Prevention and Care Council. I also serve as the executive director for the Reginald and Dion Smith Foundation, and we have a virtual community called therdsf.com. That's therdsf.com. Our mission is to provide for the wellness, awareness, and restoration of Black people with and highly impacted by HIV, viral hepatitis, and or substance use disorders, particularly in rural and southern communities in the United States. And so that's why, for me, it's a great thing to be a part of G-PACC, because I get a chance to meet all of the different people across the state, and we've been able to do some networking. And that's how we found out, that there's some gaps in services, there's some gaps in data, and as a result, there's gaps in funding. And maybe there may be a reason why there's a dominant narrative around HIV, and that's one of the reasons why we're here today. Now, my wife Dion, Dr. Luther Virgil Jr., who I hope will show up later on today, and I formed the RDSF in 2012 to advocate for heterosexual Black men and women, and we are funded by we've got some wonderful funders, the Emory's, the Compass Initiative out of Emory University, and the Andrew Young Center for Global Leadership. It's helping us to build the capacity of our organization to do this work and to transform the dominant narrative that HIV is a gay disease. We've also got some partners, and we're glad that you could join us, that are working with us and that are doing the fabulous work in the community. We've got BLACK, the HeteroHIV Society, WRFG Radio, Anise Incorporated, Black Faces, Black Voices, the Serenity Club, and Frontline Legal Services. And we want to thank all our partners. Now, just a little bit of housekeeping as we move into the discussion. We want to let everybody know that we're simulcasting to the G-PACC Facebook page and the RDSF Facebook pages, as well as YouTube. You can add your comments there, and if you're watching there, you can add your comments and we'll stream them in. If you're there and you want to join us, copy this link, and you'll find that link also in the Facebook pages. Please, if you want to speak, everybody's in the background right now, so you can just raise your hand, put your hand up, or put "speak please" in caps, all caps, in the private chat, and our team, Tanisha Baker and Ty Freeman, will make sure that we see you and get you on screen. And your experiences are welcome, but please be brief and clear with your sharing. We also want to set the intention and let you know that our intention is to make clear what you equal you means. A lot of people don't know that it means undetectable will make this a great possibility that you'll be untransmittable. And that's important to know. A lot of people don't know that. We will define and discuss PrEP and PEP. PrEP means pre-exposure prophylaxis and post-exposure prophylaxis. And I'm glad to see Dr. Luther Virgil's here, and so he'll help us really hone down on that. Unity does not require uniformity. We don't all have to be the same in order for us to get along and work together. And we need to come together in order to end the epidemic. And that is our chore. That is our goal. And we also want to make known the unknown. There's a lot of things we don't know. And so that's why we have these listening sessions, so that we can tap into what's going on in your head, what's in your heart. I know what I see. Let's tell us what you see. So and to start the conversation, and before I bring anyone else on stage, we've got a short clip that we like to play. It is from Saturday Night Live. And when I saw it and when it was pointed out to me, it just made clear that everyone knows and can see that there is, and has needed to be a focus on priority populations thus far in the fight against HIV. And as a result, we may have overmodulated. And so now we maybe need to make some corrections. And I think that people are starting to see that. And I think this was just a great way to start that conversation. So let's take a look. It's a 4-minute clip. You tell us what you think, and then we'll have the conversation and bring some other folks in just a moment. All right. Yep. So when I saw that, it just, let me know, wow, okay, everybody else is seeing what I'm seeing. When I see commercials for drugs, or when I see anything regarding HIV, and I started asking people, say, what do you see? And they say, basically, it kind of helps to reinforce the idea that HIV is a gay disease. And it is not. We know that. And if we want to end the epidemic by 2030, which is our goal, then we have to get everybody involved. And so I wanted to bring on some folks and see what you guys are thinking. What are you seeing out there, and maybe some of the healing solutions? I know that a lot of people don't know what U equals U means. A lot of people don't understand what PrEP is and how it can be useful in stemming the proliferation of the virus. And so we brought on my good man from all the way from way across Georgia, Dr. Luther Burgess Jr. He's here to make sure that we stay on point as far as the medical information. And if you have any questions in the audience, please raise your hand and we'll get you on screen. And my good friend, Reggie Irvin. He's Reggie number 1. I'm Reggie number 2. Don't get it twisted. and he's holding it down. We have some similar history in terms of our journey, but I'll let him tell you about that. And so, guys, what's going on? Tell me, Doc. You're the one that really put me onto the video. I saw the show, right. But what were you seeing when you saw it?
Well, I mean, when I very first saw the video, I said, let me give Reggie a call, because it really, honestly, Reggie, kind of gave me a flashback. As I've been dealing with patients with HIV disease since 1986. And so I have kind of a long history in watching exactly where we've come. Some great strides have been made. But looking at the issues of dealing with what is, towards being identified with HIV, and then the fact that individuals who were heterosexual were immediately being associated with being men having sex with men, and that causing the problems, the stigma, causing problems in how we were trying to address the issue. We've come a long way with that, which is absolutely wonderful. But that's what that reminded me of. And I hate to say it like this, the old days.
Right. And indeed it does. We want to dispel that dominant narrative. And in order to do that, we, feel like we have to get some different kinds of imagery and get a better understanding. Because look, Black women are the ones who are the highest rate of new infections. And they are saying that and we believe them, contracting it through heterosexual contact. And so the question comes to mind as to who they're having sex with, who they're getting down with, and we want to say that we're not here to place blame or to put anyone in any categories. We just simply want to say that no matter how you're getting down, brothers, we need to empower our women and protect them. So, that's the only way we're going to end the epidemic. And so, Reg, tell us a little bit about what you see out there in the community and what's been going on in your life.
Hey, family, what's going on? Hey, doctor, ain't seen you in a minute. How's that AC unit?
Doing well, man. Doing well.
Great.
My family thanks you.
Hey, man, it's always a pleasure, man. Thank you. It's not HIV. It's not a gay disease. It's a life on life term disease. And as I was in my addiction, anything goes, you know what I mean? And you uninfluenced, I stay influenced every day, day in and day out. When I got clean in 2003, I met a young lady, and she was getting tested every 6 months. Mindful, I'd never been tested, and so we went and got tested, and my test came back positive, and she was still testing negative. So by God's grace and mercy, and she still tests negative, and so I got tested, and it was one of the saddest, frightening things in my life, because all I knew about HIV, you get it and you were dying, and wasn't nobody talking about it. As I got clean and I got introduced to people like you, Reggie, and who actually share your experience with me, man, and it gave me the courage to face it. As I now sit here, I'm undetectable, and I've been remarried. Me and my wife had a daughter, and they both tested negative. And and like you say, if you're untestable, you can have unprotected sex, and which is brought me to the point about taking care of myself, going to the doctor's appointment, doing what the doctor tell me, and keeping the drugs out, of course.
Mhm.
And I sit here today with over 19 years clean, and that's a big, huge part of it,
Mhm.
and keeping the drugs out, and so like I said, man, it's not a gay disease, it's a life on life term disease, and I'm grateful for the work that the doctors have done. I take one pill a day, and you know, HIV is in my rearview mirror, man. But
Mhm.
I'm here to talk about it, share my experience that people that don't get tested, they'll walk around with a deadly disease and they spread it.
Right,
You
right.
know, Reggie,
They
if you don't
do.
mind me, Reggie, because of something that Reggie, Irving said that is really important about it. He said that he was never being tested, and obviously that was very important to him about the fact that he found out he was positive, and then by the grace of God, the young lady he was with did not turn out to be positive. And I think that does go along with some of the issues that you were talking about when you first brought up, and the question you put across the screen about the undetectable being untransmissible and that issue, because it talks about the basis behind that, which is the viral load. From the 1996 on, there were many studies that my colleagues and I were seeing that kind of showed us, and also from clinical follow-up of our patients, that the viral load was associated with the actual transmission of the disease. Simply put, the greater the viral load in the patients we found, and we had patients at that time with viral loads over 1 million, 2 million, so high we couldn't count them. But the higher the viral load, the higher risk of individuals transmitting the disease.
Mm-hmm.
Those with lower viral loads had a lower transmission risk. So we saw that back in 1996, 97, 98, when the first antiretrovirals became available, because that's when we first start seeing viral loads start to drop in patients. And so that has led to what we've discovered, and which was confirmed in 2017, the U equals U, the undetectable equals untransmittable. In other words, what it's saying is that if you have a viral load that's undetected, and remember, an undetected viral load does not mean you have no virus in your body. An undetected viral load means, as you place, for all to see, it means that the test that you're using for testing for the presence of the virus in your blood detect any virus, indicating the amount in your bloodstream is so low that it can't even be picked up by a test. And back in the 1990s, we had tests that were 1,500 copies. We have, of course, better tests now, some tests down below 20 copies, but the main tests back in the late 90s, early 2000s were viral loads less than 200. So one of the things that became a statement for our individuals was that if a person had a viral load below 200, and that was the viral load test they were using, it was undetectable for 6 months or greater, then they had pretty much no chance of transmitting the virus sexually. Now, a lot of people don't understand that there is a difference between undetectable and untransmittable as it relates to sex, pregnancy, breastfeeding, and injection drug use. We know that with sex, oral, vaginal, anal, that is 100%. Most providers will tell you it's 100% chance that you're not going to transmit the HIV if you have an undetectable viral load for more than 6 months. And with pregnancy, passing it on, and remember, pregnancy includes labor, the whole pregnancy itself, labor, delivery, and then the baby may be given some medication afterwards. You can make it about 99% if you're undetectable. With breastfeeding, there is still a little bit higher chance. And then with injection drug use, we don't have that exact information about undetectable making it untransmittable if you're using injection drug use. So remember, you're actually taking the virus and injecting it directly into your system when you use the IV drugs. So it's a little bit more difficult. But what we do know is that I've seen about 5 or 6 studies that range at around 74% chance of not transmitting, which is really great compared to the having no protection. So U equals U is an amazing thing. It tells us all that we should actually get to that point where we're undetected and keep and remain undetected.
And that's the good news, because I'm telling you, having been diagnosed in 1988, contracted in 84, I was an IV drug user, and also, had multiple sex partners. I didn't know how I contracted the virus, and it didn't really matter once I found out I had it, because the main thing was to not pass it on to my wife, who was pregnant with our first child together, and to stay alive. And so it was about protecting her and my family. And so through God's grace, we've been able to maintain. She just recently got tested again, and I'm so grateful, because we used condoms for a long time. And I know, guys, you don't really want to use condom. It slows things down. Don't feel the same. I understand all that, but we do what we have to do in order to protect our women and protect our families. And so through God's grace, Reg, you know what I'm talking about. Our wives are still HIV negative. Now, when I heard that U equals U, and that I might be able to safely throw this condom off, and we might be able to raw dog, get down, be spontaneous, that opened up a whole new world of possibilities again. Things that I had thought that we would never be able to enjoy again. We are able to enjoy, even in our senior years. I know you kids think that, grandma and grandpops ain't doing it no more. We are. And to keep them safe. And so that's why, I think that one of the things that have been slowing people down from using condoms or from understanding what U equals U or getting medications is that they don't understand, if you are undetectable and using the medications, then you can have sex any way you want. You can get down any way you want to and feel safe about it. And it will also allow your partner to feel a lot more free about having sex with you as well. Because no matter what they say, there's always something psychologically going on in the back of their minds about the possibility of contracting the virus. And so there's a lot going on. And we want to bring some other people into the conversation. So there's some other folks out here that have some things that they'd like to say. They may want to contribute. We don't want to be a men's group, so if you don't mind, Krista, can we bring you in? All right. Hey, I want to welcome Krista and Lou to the conversation, and talking about, of course, heterosexual Black men and women with HIV. We want to say, kind of focus. U equals U. We'll talk about PrEP a little bit later on. Just some healing solutions on how we can change the dominant narrative and start getting some of our stories out about what's going on with HIV in the hetero community. So welcome to Krista and Lou. What's going on with y'all?
Well, thank you for inviting me in. Hi, everyone. So I guess my perspective on it from my previous roles here at AIDS Atlanta and AIDS Healthcare Foundation, I used to run Sisters with a Voice. So we had a lot of members who were positive, a lot of women who were getting it while they were married, older in age, young women. And I think the main issue is people not having conversations about their sexual history. People are afraid to talk about it, afraid to bring it up, afraid that they will offend their partner if they will ask them about their sexual history, about getting tested together. So I think it starts with just having those conversations and not being afraid to have those conversations, because, of course, with Black women having the highest rates, and we know for the most part, we're having sex with heterosexual men, or at least we think we are. There are definitely heterosexual men out there who are positive and may not know their status or may not want to know their status. And so it will continue to spread until people take ownership of their sexual health.
Yes, indeed. So thank you for all the work that you do in the community and giving us some of the information about what's going on. Lou, what's going on with you? Oh, you just
okay. No, I just cut it back on. Thank you. Yeah. I'm glad to be here. Especially I haven't been into the loop of HIV because I really worked with a support group. Matter of fact, I really started a support group back in 2006, and it's called Plus Friends. And since the COVID hit, I've been stuck. Not trying to be involved with anybody. But just to go back to what I would definitely have to look at and I always did when I did the groups. One thing I always used to talk about was positivity.
Mm-hmm. Mm-hmm.
Not only am I gone positive in nature about the virus, but I try to stay positive about most things, but being positive about the virus was a problem with a lot of folks in the group. And I thank God for the blessing that a lot have learned from that. And, the other thing I have to say, not the one thing, but the other thing that I always would try to lead folks to was to be conscious of the fact of you wouldn't like your child or your daughter or anybody else to catch this. So, be conscious of the fact that you need to let folks know, especially your loved ones.
Mm-hmm.
Yeah. It was a problem area for a lot of folks, but a lot caught on that, I don't want to have them catch this, so, got to get them involved, let them know what it's all about. And, thank God for the blessing that U equals U came about, because it made a lot of people more open to understand what it's all about. So I am ever so grateful that, I am where I am, and I can pass along the information without, feeling stigmatized about it, because that's the other part that really, really keeps us stuck, and about the stigma and that comes along with the daggone virus. But thank God for the blessing that, I am where I am, and I try to do the best I can to keep spreading the word.
So appreciate
thank you. Thank you for being.
I want to throw something out just for all of us and anyone that wants to answer. When you see commercials or when you see information regarding HIV, you see anything that really promotes diversity or that dispels the myth that HIV is a gay disease?
Reggie, I actually wanted to speak on that. It reminded me of the U equals U commercials that we see on TV. And I had a conversation with my mother about a year ago. And she said, I see these commercials, but it seems like it's for gay men or trans. She's like, a lot of people that I've talked to in the community, they don't think that, the medication is for people who are heterosexual because the commercials don't show that. So they're really kind of confused on the whole U equals U and if that's something that they can even take.
Mm-hmm. Yeah, and same thing is true for PrEP. What's the take on PrEP in the streets? I mean, I don't think that there's any data, Doc, regarding heterosexual Black men, or there's a dearth of data for heterosexual Black women regarding PrEP and PEP. I'm not sure that there's a lot of testing, or I know that there's some tests going on. I see my good friend Hermione Wilson is in the room. If I could get you to turn on your camera or at least your microphone, maybe. I know she is with the organization HeteroHIV Society, and they focus on Black women with HIV. And just what's going on with PrEP and people, having a sense of how to protect ourselves.
Actually, Reggie, there is information about heterosexual discordant couples and PrEP. And in fact, one of the most important studies that actually got the approval of PrEP was a study that looked at heterosexual discordant couples. And actually in that study, and it was a study that was partnered with a couple other studies that looked at primarily partnered up studies with gay individuals or individuals who are men who are having sex with men. It was kind of really shocking. So essentially somewhere around the 2012, 2013 timeframe, 2010 to 12, they were doing the studies. And what they looked at was in the data, they found that amongst the individuals who had one partner in a couple that of two individuals, one partner was HIV positive, one partner was not. And they looked at those individuals and the transmission of HIV, and they found that amongst the individuals where the partner who was HIV positive had a non-detected viral load, there was no transmission whatsoever in of HIV to the partner who was non-HIV positive. That is with unprotected sex.
None.
And took a look at the thousands of encounters of unprotected sex between the individual who was HIV positive and the individual who was HIV negative, as long as the HIV positive partner was non-detected. And they found not one single case of transmission of HIV.
Wow, that's big.
I remember that study.
And so therefore, that is what actually pushed the issue of using what we call PrEP, pre-exposure.
Let's just briefly explain, as concisely as you can, please explain what PrEP and PEP are.
Okay. PrEP is pre-exposure prophylaxis. That is, you are not exposed to an individual. You don't have HIV. You're an individual who does not have HIV. You take a medicine such that you will not get HIV when you have sexual contact. And that was the focus of it, sexual contact with someone who might be HIV positive. PEP is post-exposure prophylaxis. That's when you are exposed to, in some way, to an individual or individuals' blood products that have HIV, and you're exposed to them without protection, and then you're given medicines to help prevent you from getting HIV. So with PrEP, you take medicine in on the front end to protect you from getting HIV, and PEP, you take medicine after you have been exposed to protect you from getting it. Okay, so hopefully that will clear those out for
that. Does clear it up a lot, you know. So in other words, it's like a vaccine almost.
It's quite not quite a vaccine, you know. Being a medical person in science, I don't want to say it exactly, but yes, it works in a sense somewhat similar to the vaccine. Because remember, with a vaccine, you take it, how it causes you to build up an immune response to protect you against the offending pathogen. Yes, so kind of.
Dr. Virgil, I have a question. So for a couple, say one's positive, one's negative, and the negative person is taking PrEP, and say for some reason the positive person haven't been taking their medication correctly, they start to become resistant to the medication. Would the PrEP stop working for the person who's negative? Or would
No. Actually, so you can take PrEP and separate it out from antiretroviral therapy for treatment of disease. Okay, so in your question, you're looking at two different individuals. The PrEP is for the person that does not have HIV. The treatment is for the person who has HIV. So they're totally different. So in this situation, we were looking at the individuals who are on PrEP were protected against HIV no matter what the actual viral load of the person who is HIV positive. Now, when you take HIV antiretroviral therapies, and this can, it can be a little confusing, so we will clarify that for everybody. When you take your antiretroviral medicines, which we recommend for everyone, the medicines are so good now, so powerful now, that they can get just about anybody down to a non-detected viral load. And once you have a non-detected viral load, that's where we work to the U equals U. So when a person who's HIV positive takes their medicine, gets a non-detected viral load, then they can't pass it on to a person who's not even taking PrEP. The person doesn't have to be on PrEP. They just are not going to transmit it. And so that's where we say U equals U. So we want individuals to always take that antiretroviral and drive that down to a non-detected viral load. PrEP, on the other hand, that person who does not have HIV takes the PrEP. That puts out a protective shield, a protective barrier, so that even when that person runs into someone who has a viral load, it protects them from getting the virus.
And that's a great thing, because now, personally, and I know many people are taking medications once a month, getting an injection. Some folks even once every 2 months. Right. And I'm told, Hermione, that the study is going on. How is the study going, Hermione? And are they using the injectables or are they using pills?
Good afternoon. Thank you. My name is Hermione Bell. I'm a nurse practitioner. And they have currently 2 studies that are looking at injectable PrEP for both men and women. Here at our site, HeteroHIV, which is a nonprofit organization that provides services to women living with HIV. We have what's called the epidemic study, and this looks at injectable PrEP. So that medication is called Aptitude, in which that's injected. Aptitude, in which that's injected 2 times a month. And it's 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 2 every 2 months. And it's for protection against HIV. And we have enrolled one person. We're going to be starting that person on their first injection next week. And
Okay.
that woman, she was excited because she had been on oral PrEP. And currently, the medications that we use for PrEP for women orally is called Truvada, or the generic of Truvada, because another common PrEP medication is called Descovy, but you cannot use Descovy in women because there was not enough data to really show the efficacy of Descovy in women. So the only option that women had was Truvada, or the generic Truvada, which sometimes can lead to kidney problems or problems with bone health. And so this injectable form of PrEP is now safer because it bypasses, of course, some of those organs because it's injected. Most of the side effects are related to the injection site reactions. And all the patients that I've had so far that take injectable PrEP or injectable HIV treatment have not stopped their medication because of the injection site reactions.
Okay, that's good to know. Well, I'm glad to know that at least we're getting some testing done, and that the Ivy is helping to facilitate the testing and the usage of PrEP in our community, because that's one of the ways that we can bring down the number of new infections and also make sure that people just staying safe, and living good lives. And so we appreciate the work that you're doing, Hermione. You've been out here for a minute.
I wanted to make one other comment about the SNL skit that you showed, and we talked about some of those commercials that people see and they don't see themselves represented. And I had similar conversations with my daughter and some other friends, and if they're identified as heterosexual, they kind of just tune out and they really don't listen to the complete commercial. And I have actually talked to the makers of PrEP medications to about that you're trying to target those populations that are impacted by HIV or vulnerable to acquiring HIV, but then the pictures or the images that people see, they don't see themselves, so they don't think that those medicines are for them. So I've had those conversations with some of the higher ups within those companies, and hopefully the message will be heard.
And that's an important conversation, and I'm glad that you're doing that. The Reginald and Dion Smith Foundation is here to help do that as well, and that's why we created the alliances. We also have an alliance with some other organizations, and I see Natalie's in the chat, and we're working out in the rural areas with folks that are in the disabled community. So I see my good friend Stancil Toodles in the queue as well. I'd like to bring some of you guys in to get your perspective on what's going on. Stancil, are you there? Toodle. Oh, all right. And Natalie, are you available to chat with us for a moment? This is our first time really kicking the tires on this particular platform, so we're going to just try to fill the room. Oh, so Barry, don't go. Barry, come back. So that's a good point. Anybody else have anything to say with the imagery, about the imagery that you see regarding HIV and what we may need to do? How can we advocate for a change so that people see themselves and hear themselves when this important information is being shared?
Hey, Reg, I would like to say one thing. Well, first of all, quickly, just so individuals know, people ask me a lot about the fact that why is some PrEP not available for women? And Hermione touched a little bit on that, and that's why one of the things we're looking for, the aptitude, and hoping that the injections, the aptitude, will work really well. But one of the things we have seen with PrEP, some of the earlier forms of PrEP, and is that it pools higher in the rectal tissue than it does in the vaginal tissue, and so you can get very high doses in the rectal tissue more than in the vaginal tissue. And actually, most individuals believe it takes a longer time for you to get the actual protection of the PrEP when giving it to women than when you give it to men, based on that. So that's just maybe something to help people to understand one of the reasons why you get some suggestions that some PrEP be for men only, and that more of the studies have been done.
Okay,
in that. As far as what you were saying about that commercial, yeah, there's something that I found very interesting, especially earlier in treating HIV, and it's come along, is that the concept about what is an individual who is heterosexual versus having heterosexual sex, or men having sex with men. So when you talk about an individual who's heterosexual, what we found was that is kind of a definition of you define yourself as, I am heterosexual. I have a tendency, when you talk to the general population, a tendency to have love with women or someone of my different sex. But the actual act is maybe a man having sex with man, or because a heterosexual person can have the same kind of sexual acts as a man who's having sex with men. You can have anal intercourse. And so I think that sometimes that also creates a problem. Something of interest that we did when we were studying in Washington, D.C. in the late 80s, early 90s, we would ask men, and a lot of the men would state that they were heterosexual, and they just defined themselves as heterosexual. But that didn't mean that they didn't have at least some sexual encounter with a man. And we found this especially true with individuals who were in the prison system. Mm-hmm. And we found that in doing some localized studies there, when we had men who were in the prison system for more than 1 year, there was a very high percentage of them who had at least one encounter or sexual encounter with a man. But they were defining themselves definitely as heterosexual. And when they came out, even their female partner defined them as heterosexual. But had that same man had the same sexual encounter with a man and not been in the prison system, then that female partner would not define them as being heterosexual, especially in the African American community.
Right.
And that their partner would define them as being gay or being homosexual. So these are the kind of complications that actually affect what we're talking about right now. So that commercial that's why I said that commercial brought that back to me about how we're defining and how the individuals we would interview as treating with HIV, how they would define themselves. So I just wanted to say that.
And I'm glad that we're having the conversation, because yes, it does. There's so many different situations that the definitions and the categorizations of people is a complication in and of itself. The bottom line is that HIV is a virus and it affects sexually active people. We also know that it affects injection drug users, but that's not the most important thing. The most important thing is that we stop transmitting it to our women, and if at all possible, try to keep from contracting it ourselves as heterosexual Black men, and that we are putting out information that is receptive, that is more receptive to people who want to see themselves. You know, everything is really focused towards the LGBTQ community. And we just want to kind of balance that out so that everybody's getting the information, which is why we're sharing about U equals U, making people aware of what PrEP is, and just getting a sense of what's going on in the community. That's why I asked Natalie and Tootle, as well as Barry, to come in and give us a little something about what's going on in your neck of the woods, Natalie. Let me check your microphone. Microphone check 1 2 1 2.
Can you hear me?
We can hear you. Yes,
Okay,
yes.
perfect. Hi, everyone. My name is Natalie Chambliss Beach, and I work primarily with pharmacy services here at AIDS Healthcare Foundation. I work closely with our wellness center, so I see a lot of the PrEP patients coming in, starting PrEP. And what I'm finding is that you see a lot of younger men coming in to get on PrEP. Unfortunately, many of them will be on PrEP for just a short period of time, and then they come out of being on the regimen for a few months or what have you. And in the interim, sometimes there are infections. With that being said, though, I have lately seen an uptick in females coming in for PrEP as well. Of course, there are a lot of new regimens coming out that will certainly assist with the viral load suppressions and things of that nature. I know that Gilead has come out now with a new drug that is primarily targeted towards people who have a lot of resistances towards other medications, and it will be, taken in conjunction with something else, but it will be injectable. I think only given 2 times per year. So we're excited about that in terms of just being able to keep people who are more at risk and have more trouble being virally suppressed with the help of those new drugs out there. And of course, Apretude is definitely a game changer as it relates to women being able to protect themselves. With that being said, though, I am definitely seeing more PrEP being prescribed, not just to people who are in the LGBTQ, but people who are out there who have multiple sex partners, are those who are embarking in new relationships. And as I have 2 young adult daughters, and their idea of sexuality is very different from the way I was brought along. And what that means is that in talking to them, they're very open to, people who are bisexual. They said they don't have a problem with, which is perfectly, fine. But what that means is that they have to then be more vigilant in keeping themselves safe. So we have those conversations. And what I think is good is this type of forum where we can talk about where we see those gaps as it relates to HIV and the stigma, and how it's always associated more so with people who are homosexual. Whereas we're all at risk. If we're out there having unprotected sex, we are at risk. So I think this is wonderful, Reggie, Dr. Virgil, and Hermione, thank you so much for all of your insight. But that's where we are and what I'm seeing on the front lines.
Well, thank you very much. We need to hear that. And just briefly, what's your take on the imagery as far as information that's being sent out, pharmaceuticals, pictures, and just what do you think about the imagery as it pertains to HIV?
So as it pertains to HIV, the imagery should be more representative of the people who are truly dealing with it. And as you know, Black women are being infected Black heterosexual women are being infected at higher rates than anyone else at this, new infections and so forth. So, we know that that's an area where we don't see imagery.
Yes.
And as people within the industry, I think we all have some connections with the pharmaceutical companies and things of that nature. And this is something that they need to champion so that we can not only change the stigma, but also change the narrative as it relates to who HIV is really impacting. Okay.
Yes. I agree. And I'm going to bring my good friend Barry Sermons in, and I'm going to bring also Tito Terry back in just a moment. So because I know we've got history going way back as it pertains to getting information in the HIV community. But before we do that, I'd like to talk to my good friend Stan Tootle. Stan Tootle. Is your mic on? Let me see if we can get your mic on, because I know Tootle's working out in the rural communities, and he has. We need somebody to turn your mic on. And I wish. Oh, I got you. Let me help you out. Oh, right. I can't unmute you, Ty. See if you can get your mic open, Tootle, so we can find out what's going on in the disabled community as well. Because, I just had an opportunity to travel with my man, Tootle, and you would be amazed at the things we don't know about what's going on in the disabled community. Tootle is the father of 5 daughters. And so I'm sure he has a lot to say. So, but while he's getting his microphone together, Barry.
Hey, what's up, Reg?
All right. How are you today, brother?
I'm doing great. Today's a good day.
Barry and I go back years in this thing.
Yes.
Barry, you want to talk about it? I don't want to.
Yeah, I can talk a little bit about it. So actually, I'm right now in Hilton Head with my wife, and we're her birthday was last Thursday, and my birthday is this Thursday. So we're just taking some time. Um, but you know, I'm an HIV advocate now. 20 years ago, matter of fact, I was diagnosed 20 years ago on my birthday. So in 2 days, it'll be 20 years. Um, and you know, I was like in the shadows and stuff. I did know Reg from before this from another place, but you know, I was kind of hiding in the shadows because I didn't want to be seen, especially in a place where AIDS was on the sign, you know. And but I got to a point where I kind of had to, because of healthcare insurance, I needed to get some place where they could pay for my healthcare insurance. I had to go in and get some services, you know. And my very first case manager told me, Barry, check this box here. I said, but that's not me. She said, if you check this box, I have a bunch of services that I can connect you to. And she saved my life. And she sent me on a bunch of services that I'm still, you know, 20 years in, still, you know, still taking advantage of.
What was the box? What was the box you checked?
Oh, that MSM box. Come on now. I had to check that box, you know. And you know, and so she sent me into this group of men. And matter of fact, this is where I knew Red from before, and I saw him in this group called Men of Color in Motion. And this guy, Richard Anderson, he's the guy that told me I was going to be an advocate one day. And he welcomed me into this group, and this was probably 30, 40 all black gay men. And the only two people that were not in that cohort were my wife and I. And we went to those meetings for years. And my wife went as my bodyguard because I had to be sexually assaulted to be a part of that group. People would fill me up in the circle. And, you know, I wasn't trying to beat nobody up. I was just trying to live. So I had to bring my wife with me. And a couple of guys, I look at them, I say, do I need to call my wife over here? So anyway, you know, and then we found another group, and we created a group called Together We Can. And a couple of the guys here were part of that, you know, and that's really where my wife and I kind of moved forward and kind of flourished, because 2015, my wife died HIV negative from breast cancer. And I was undetectable after the second year. My doctor said, well, you know, because he was really, really connected. He said, you know, I went to the International AIDS Conference, and there's this study out and all this, and everything's cool. But because the community was so condom shaming, I knew the truth, but she was afraid. You know, she was afraid. And then she died when the U=U conversation became popular. And I cry every day that our intimacy was interrupted through the end of her life because this was not public knowledge. And so I'm going to finish up and bring it around and say, I am here today with my wife. We got married July of last year, who is HIV negative. And because I know U=U, and I allowed her to understand what U=U means, we are not afraid. We are not afraid.
I'm going to tell you, Barry, you know, I'm glad you brought that up. We do go way back. And I thank God for the LGBTQIA community. I thank God for all their advocacy and the groups and the information and everything that was done in order for us to get to the point where we are right now. Because, you know, but we were able to go in those spaces because we were aware of one thing: you can't save your face and your ass at the same time. And if your ass is on fire, the only thing you want is water. And the water was in the places where gay guys were. And so we had to be willing to go in to the Lions Den, even if you thought you were wearing a pork chop suit. Obviously, they thought you were a lot more attractive than I was because nobody was hitting on me. I don't even understand it. But that being that the case, a lot of brothers, and Reggie, wake up. Hey, Reggie. Come on, man, wake up. Yo, Reg, let me ask you this question, man. Let me ask you this. So, like, did you make any support groups like early on? Have you ever made any HIV support groups other than the ones that we had?
Well, no, I haven't. But I share openly about my status and about living with the virus and my meetings, my 12-step meetings I go to.
Okay.
And so that opened the platform for somebody to come up and who didn't have a voice. So I did have a couple people to come up to me, and we exchange phone number, and I still talk to them today about living with the virus. You know, because I believe, you know, each one teach one. You know, and I wanted to talk about the stigma about the commercials. You know, even my wife said, she said, "Why all the commercial about gay men?" You know, and I said, well, at the beginning they said it was a gay disease, and so it's not. You know, we know now it's a life-on-life term disease, and so the other guy was so reluctant about following the script that he didn't care about the script. Like, he just wanted to know that he wasn't gay. So right. Well, I got mine through a woman, and I got mine by playing basketball with Magic Johnson and shit like that, right? I was like, well, you know, I've been told to focus on the similarities, and the similarity is that I got affected with HIV. I didn't care where it came from. I just want to know how I can save my life. And, and like I sit here today, like I said, man, I'm part of the you know, you understand, you know, undetectable, untransmitted, you know, and I live a great life, man, but it's still work to be done.
There is. And that's what we're doing this work right now, because we need to have these conversations, and we need to have them in-house as well. First and foremost, heterosexual straight guys need to stop being afraid of men who are having sex with men. We need to stop being afraid to go into those spaces and interact with each other, because it's only through us being united that we're going to actually end the disease.
Hey, Reg, can I say one more thing now?
Sure.
Okay, I just want to jump in here because I heard about the imagery and, you know, all those things. There's an elephant for me in the room, is that when gay white men were setting up the funding streams, and when they were creating organizations, they were creating them for themselves. And then what happened is the virus jumped over to black gay men, right? And so they started setting up structures, and they were putting things in place for themselves, not thinking that it was going to jump anywhere. And now it's jumped to women. And I'm here to say, I advocate for people living with HIV, period.
Right.
Martin Luther King, he marched with the sanitation workers, but he wasn't a sanitation worker. So I march with everybody. Thank you.
Exactly. And that's why we're here, so that we can get past a lot of the nonsense, in my estimation, that we're all human beings. And, you know, there was it was a good reason that the LGBTQIA community galvanized the way that it did and continues to galvanize, is because the general population, the so-called straight community, has been targeting transgender, gay, you know, and still today the laws, it's just so much that has not changed. But we have a situation where we can come together as human beings and make a change, as we have continually been doing with the medical community and so on and so forth. I wanted to bring Tito in because Tito, I hope you don't mind me saying that how do you identify, Tito? What is your pronoun?
He, him, his, gay man, Hispanic, Caucasian, yeah.
Mm-hmm. So I know that you're involved at DPH as well. What are you seeing? One of the problems with making change, and Barry brought up a good point, was that a lot of the funding is going towards organizations prioritizing men having sex with men, LGBTQIA, and that is as a result of the need. The need is there, and so the funding and the advocacy has been there. Now we want to make sure that we take care of everyone so that we can end the disease. What are you seeing at DPH? And because there's no data, do you see any data available regarding heterosexual Black men?
The only data that I can tell you that I've seen is if you're doing testing activities, if you're doing outreach testing, one of the questions is you identify what you identify on the particular paperwork, the CDC bubble sheets is what we call them here within the agency. If you identify what you personally feel that you identify as your race, and you also whether or not you've had sexual contact with females in the past 12 months or males in the past, or transgendered individuals in the past 12 months. So it's my personal belief that the data is there. It's just I think we could always do a better job pulling that particular data out of the information that we have.
Yeah, and I think it's been my understanding as well that, as Barry alluded to, sometimes there is a mischaracterization of the data. That if, like the doctor was saying, if someone's coming out of prison and they may have had sexual encounters in prison, but they still identify as heterosexual, and if they share that they had that encounter, then they go into the category of MSM.
Yes.
And so it leaves us lacking information, and sometimes we get misdiagnosed. And might I say, and I want to bring my good friend Tootle back in now that he's got his mic open. Tootle will tell you that there is just people with disabilities is just invisible. I mean,
Yes.
in terms of categories and getting information and representation as far as imagery is concerned. Tootle, briefly as we begin to, and I'm sorry, we still have time for you, but we want to start trying to wrap this thing up. Tell us a little about what's going on in the disabled community as it pertains to HIV and in the rural areas.
Okay, good afternoon, everyone. And this is a very interesting conversation. And thanks for inviting me, Reggie. There's a whole lot of stigma amongst my peers as far as people with disabilities, and I think, well, there's no think. There needs to be some specific education done as far as getting the proper information out. Up until this afternoon, I didn't know anything about the what is that? The U equals U thing, and I'm really interested in that, and I'm also very interested in when people are, and now you guys tell me if I'm using the proper language, but when someone is registered as, when someone tests positive on the documentation, is it asked, do you have any type of prior disability prior to testing positive. Because I think that's some valuable numbers that need to be documented also. And my other question that I got when it comes to the PrEP and the PEP, does Medicaid or Medicare, will they pay for those treatments?
Those are good questions. Those are very good questions. Let's see if we can get somebody in that can answer that. Krista, you might know a little bit of what's going on with that.
No, I'm not sure. I'm sorry.
No? Okay. We want to know who's paying for it. That's a good question. Hermione, let me see if Hermione, are you still there?
Yes. So actually, most insurances will pay for the medications. Some do require what's called a prior authorization, meaning that your healthcare provider will have to fill out an application so the insurance will cover it. But you can get the medication for free through programs like Ready, Set, PrEP, which is a government program. And the only drawback to that is you can only get the oral medications through that program at this point, and it does not include the lab monitoring that you would need every 3 months being on oral PrEP. So yes, Medicaid and Medicare do cover PrEP medications.
All right, that's good news.
Okay, and so so if and now tell me a little bit about the timeline. If an individual tests positive, is there some type of procedure they got to go through to become eligible to use the PrEP or the PEP? And I also read one time that that the PrEP was not being advertised very much or used very much by minority groups. Or is that still the case, or has that has the information made it out into rural Georgia that PrEP is available?
Well, go ahead, Hermione.
I was just going to say that yes, it is quite evident that the PrEP uptake in communities of color have not been as robust in those of communities, the white community, especially MSMs. And so there has been a push to identify or different avenues or different routes in which we can educate those in BIPOC communities who are unaware that PrEP is available to them. And so, getting the word out, as I said earlier, and some other people have said earlier, to get the imagery that is seen when we talk about PrEP to not reflect the category or those individuals who already know about PrEP. 90% of those prescriptions that are written for PrEP in the United States as of 2020 have been written for white MSMs. And so that only leaves 10% for everyone else. And so, education definitely is key, but also, holding those companies that make these medications accountable for their part in, just perpetuating the same communities who are vulnerable to acquiring HIV.
Okay. Good conversation. I am enjoying this.
Discussion around the rural communities as well as persons with disabilities, because in many instances, they are forgotten as well. So we want to remember that our ultimate goal is to end the epidemic by 2030. And I know when we first, for a long time with HIV, we were afraid to talk about cure, We were afraid to talk about even thinking about ending the epidemic. We began to get a lot more bold in the last 5 to 10 years when we realized that the medications were working. Things are evolving. Now we have medications that you can take injected, some people, for a month or 2 months at a time. And that is very helpful. Now we would like to change the other social determinants. And so one of the things that we did at the Reginald Dion Smith Foundation is we created a virtual community. And the virtual community is focused on wellness, total wellness, awareness, being aware of the different things that are available to us, and sharing those healing solutions with each other as we recover our right relationship with ourselves and with the universe. And so we have wonderful information between us. We have to continue to have these conversations. I would ask you all to join us in the rdsf.com, and we'll leave a QR code up at the end of this broadcast so that you can come on and join us if you haven't already. And Dr. Virgil, we want to thank you and everyone else for joining us today and bringing so much great information and stimulating conversation. Now, one of the things is that we don't necessarily talk about all the time, but it's necessary, is that funding is necessary in order to continue to do this work. And we want to shift and change the narrative. We have to do that with changing some of the imagery and the people that are advocating and getting involved with the work. And so in order to do that, we were told, as we were putting together the strategic plan from now until 2026, that there is no ability to prioritize heterosexual Black men because there is a lack of data. And so we have to change that. And the model for that is the transgender community, because they were experiencing the same thing a few years ago, and they began to advocate for themselves. The imagery has changed. Social acceptability has changed. As a result, just like everything else in our society, we are seeing an even greater pushback from people who are in power and want to maintain power. But we cannot be dissuaded by that. I think one of the things that we want to reinforce is that unity does not require uniformity. We don't have to be the same in order to come together to achieve the goal that we're attempting to achieve. And in this instance, we're focusing on achieving the end of the epidemic by 2030. So we want to thank everybody that joined us in Facebook and in YouTube. And we would like for you to, start asking the questions to your friends and family. What do you see, or what do you think about when you see the commercials and the information regarding HIV? Because I can guarantee you that there are so many people out there, like Barry and myself were talking about, who are hiding as a result of not wanting to be us. That is what stigma is. Being more afraid of what other people think about you than what you think about yourself ultimately. And so we want to really make a change with that. So I just want to thank everybody that has joined us today. There's been so many wonderful contributions to this conversation. Tito, pass me some tissue.
Say that again.
Oh, I was referring to something that Michael Jackson told his brother Tito. Pass me some tissue. So tell me, wrap it up. What is, from your perspective, do you see, and what do you want to leave us with?
I want to leave us with a thank you, because often the issues relating to heterosexual individuals aren't really talked about with HIV. So I want to leave everyone with a thank you, because this was valuable information that is necessary. Because in order for everyone to get that same equity that we always talk about, equity in care and treatment and prevention, we need to have these conversations. So for me, it's a big thank you for all of this wonderful information.
Thank you. And we're going to take it back to G-PACC and the Georgia Prevention and Care Council, as well as the Department of Health. And we're starting to network with other folks so that we can shift the narrative. That's how it starts, obviously. Dr. Virgil.
Yes. Thank you.
Parting words, sir.
Oh man, I just want to say thank you very much for giving me an opportunity, and thanks for everybody who attended it. I'm agreeing with Tito. This is some very valuable information, and this is how we get it started. And the questions get answered. And again, thanks to you, Reg, and the foundation as well as G-PACC.
Thank you, Doc. And you're a big part in helping the foundation to begin and keep it going, and so that we can be a voice. And thank you, Krista, and all of you who are in the community, Aid Atlanta, the HeteroHIV Society, my organization, good friends over at Black. Thank you, Natalie, for your contributions. Thank you, Lou, for everything you do down in Lou's down in the Florida region. But we're with the web being what it is, we're all national now. So thank you all for what you're doing. I want to thank also Executive Assistant Ty Freeman and our head of social media, Tanisha Baker. They've been helping make sure that we get the information on screen and get the comments of the people that are on Facebook. This won't be the last session on this topic. We will be doing more of this. So we would entice you to join us inside the War Network at the RDSF.com. That's at the RDSF.com. You can see that on screen. Reggie, Lou, anything you want to say before we go?
Yeah, I just want to say, can't let the stigma kill you.
That's right. That's right.
Thank you.
Say it again. I don't think they heard you.
Thank you for the courage.
All right. We got a little hot mic, so I'm going to say we're going to wrap this up now. And I invite you to join us at the G-PACC website, which is, the website is there, but you can also go to the Facebook page and just search for G-PACC, G-PACC. Also, you can check our Facebook page, the RDSF. And once again, you can join our community. Hey, so the next time we'll say it's been fun. We got to run, and we'll see you on the other side of the moon. There'll be more listening sessions. Check your email. We'll be making sure to send out information. And please, if you get the opportunity, join us and help us to create a different kind of imagery around HIV. And if you can, advocate for someone other than yourself. Go into other communities, the LGBT community, and thank someone if you are HIV positive or know someone who is HIV positive, or the advocacy work that they have done to get us to the point where we are today. Or just go kiss a doctor. Huh? How about that? Like Dr. Virgil, who's been doing this work for years and have helped us to still be alive today. So, until the next time, and Reg, and we'll see you on the other side. Until then, peace and blessings.